Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the COVID-19 situation in the state of Maryland and also here at GBMC. So it's pretty good news. This morning, there were 353 people in Maryland hospitals with COVID-19, and only 83 of those were in intensive care. So we are continuing to see a downward trend of the number of patients with this disease who are hospitalized. So again, I want to thank all of you for washing your hands, wearing a mask, and staying 6 feet away from others, because it is working. We need to be vigilant as the weather is changing, and there will be a tendency for us to spend more time indoors. We know now that indoors, the ventilation isn't quite as good, and we are more likely to be within 6 feet of each other. So again, please wear your mask and wash your hands. How about the situation at GBMC? Well, the news here is good as well. This morning, we only have 7 patients with COVID-19 in the hospital, and we have only 1 person awaiting a test result. When there are fewer people coming in sick, it creates less pressure on our test kit supplies, so we are then able to use our scarce rapid test capability to get answers faster. So again, let me thank you, because as you lower the burden of the disease, you make it easier for our doctors and nurses to get the job done. How about nationally? Well, this week you've heard a lot in the news trying to predict when the immunization will be available, and you've also heard some dialogue about the use of masks. Let me come to the answer about the masks first, because that's easier. The evidence is now clear. Masks protect you from spreading the disease to others and also provide some protection to you. So don't get confused about people talking about masks. They are effective, and you should continue to wear them. Now, how about the immunization? How likely is it that we will get the immunization quickly, and how effective will it be? Well, scientists want to make sure that immunizations are both safe and effective. And you will see the terminology in the newspaper about phases of immunization trials. You should really remember phase 2 and phase 3. Phase 2 is when a substantial number of healthy individuals get the immunization for one purpose: to make sure that they will not have significant negative side effects from the immunization. The Centers for Disease Control and Prevention and the FDA want to absolutely make sure things are safe before they extend the immunization to many more people, thousands of people, to see if it is really effective against the virus. So they do what are called randomized controlled trials, where everybody gets a shot. Some people get the vaccine and some people get a placebo, and then they watch the course of these individuals to see who gets the disease and who does not. That's called a phase 3 trial. Now, obviously, in phase 3, if we are waiting to see who's going to get the disease and who won't, we have to wait a significant amount of time to get the results. The more people we give the immunization to, the shorter the time may be before we see the pattern, to assure ourselves that it is the vaccine that is preventing the disease. You will recognize that once the FDA says, yes, we have evidence that the vaccine is effective, it then has to go into production. And we are talking about giving the vaccine to potentially billions of humans. There are 350 or so million Americans that could potentially get the vaccine. So you see, we need a lot of vaccine. There's good evidence that the vaccines that are being tested are effective, but they won't be 100% effective. The typical influenza vaccine is effective in the range of 70% of protecting you from getting the disease. The vaccines also may be not effective at stopping you from getting the disease, but may mitigate the disease within you, make you less likely to get severe infection. All these things need to be taken into consideration by the scientists before they decide that the vaccine is effective enough to put out into production. I think it is very likely that we will have a vaccine that the FDA authorizes to be given to humans sometime probably early next year. But then the question is, how fast can we produce it and who should get it first? It is likely that healthcare workers, doctors and nurses will get it first, and it is likely that the second group to get it are the people at the highest risk of getting severe illness, who are people who are elderly and have chronic disease. Will we have enough doses to immunize every American before the end of 2021? I don't know, but I can tell you that the government is incentivizing manufacturers financially, and there will be a race to produce enough effective doses to give it to every American who wants it. Remember, we want to try to get to herd immunity. We want to try to get to 95% protection, because then we can rest assured that the epidemic will stop. But even if we get up to 70% effective, that will clearly reduce the risk in the population and will be helpful. But as the head of the Centers for Disease Control, Dr. Redfield, said, we would still be well served by wearing our masks until we're sure that the risk of disease is low enough for us to stop wearing masks. When will that be? No one actually knows. But stay tuned. Things are looking good now. A reminder, wash your hands, wear your mask, stay 6 feet apart, be cautious as we all move indoors. So thank you very much. We are here to serve you if you need us at GBMC. Let me thank all of my colleagues in the healthcare profession for their ongoing wonderful service for those who are sick with this disease.